Hi, Ms. Duggar. Thank you so much for providing this draft of your research questions. I'm just going to go over a few things, and then I'm going to send you a revised version of the question. But like I said, this was a very good first draft of the questions, especially since we've had such a short amount of time for you to work on the project. So a couple of things just to keep in mind with qualitative research. Always think about your target population, meaning the population that you are going to be interviewing. And in general, always think about keeping the questions as simple as possible in terms of the length of the question, the number of things that you're asking in a single question, and also terminology that you're using in the question. So even though we're dealing with college students, we still want to keep the language that we use in the questions very simple and straightforward. So a couple of things, just as an example, like with this question here, what risk, concerns, or obstacles, like you're asking 3 different things. So in general, you should always keep the questions to like one thing. So if you really did want to know about each one of these individual things, then you should have a separate question for each of these things. If these things are representing one common theme, then you can just use one term that would describe all 3 of those. So again, just simplifying the question, because if you ask a question like this is kind of complicated and women or individuals will be like, oh, I'm trying to think about all 3 of these different things. And, we don't want people to feel confused when we ask questions. So I did make some revisions, and we're going to go over those in a second, but a couple of other things I wanted to point out that are important. So for example, here you use the term disparities, and you did not use the term disparities correctly. So disparities are preventable differences and that are unjust, right? So when you use the term disparities, it's not just meaning differences between outcomes, but differences due to unjust factors. Those are disparities, right? So also terms like barriers, terms like societal or cultural, those are like $100 words that we don't really use when we're in the field collecting data, because we want to keep the questions as simple as possible. Not that we don't think people are intelligent, but just the average person really doesn't know what the term societal beliefs or cultural beliefs mean. So for example, you can just say, what do people in your community think influences the perceptions of cervical cancer, right? So you can get at the same question without using the $100 terms, right? Like barriers, I think, right? So are you aware of anything that may prevent young women from getting cervical cancer screenings, right? So just keep the language simple and straightforward when you're asking questions in the general population. Now, if you were doing this interview with like healthcare providers or people who are more highly educated, and you know that they would know these terms, or like if you were interviewing someone in the field of public health, they would definitely know these terms, and then it would be okay to use it. But again, general population, we just keep the language very simple, very straightforward. Also, we're not going to be focusing a lot on HPV with this particular project because we're more so interested in cervical cancer screening. Now, even though HPV, of course, is a causative factor for the majority of cases of cervical cancer, we're more so interested in people's perception of cervical cancer screening. So we can kind of start looking at why women are not getting screening at the same rate as they used to years ago. So I did make some adjustments. So take a look at these questions. I did add a couple of icebreaker questions. These are just general questions. And these are questions that I generally ask on most surveys that I do. Again, just kind of as icebreakers, get people to think about cancer in general, and then ask them more detailed questions about cervical cancer and cervical cancer screening. So I did use your questions as a base, and I did make some modifications. So take a look at these. Go ahead and add these questions to your survey. Remember to use the essay box entry so that you have a large space to enter the answers of the participants. And of course, let me know if you have any questions. Thanks.